couple of weeks ago, I brought you some polling from True North Research showing that people's fears of the Delta strain were at least 38 times higher than the reality. We've got some more polling from the same company tonight, and it shows that the three things people fear most from lockdowns are the loss of jobs and income at 25%, mental health and anxiety issues, we just heard David talk about, at 22%, and the impact on small business at 18%. The impact on family, education and even national debt are much lower concerns, the research shows. Jeepers, I would have thought debt and education were very high for me. And given the New South Wales lockdown costs about $1 billion a week, True North asked people whether they'd rather a 500-bed hospital, which could be built from money saved in just 3 weeks of locking down. But less than 1 in 5 people would rather scrap lockdowns and spend more on health facilities. 37% said go ahead with lockdown whatever the cost and go for zero COVID. And the biggest share, 46%, or nearly half, said split the difference, shorter lockdowns and more money for health. They want their cake and eat it too, right? But here's a fun question. What about the ABC and Kevin Rudd and those claims I ridiculed earlier this week that Rudd was the one who helped bring forward Pfizer vaccine deliveries for Australia? Fewer than a quarter of people believed the ABC's characterisation of Rudd as the saviour. That's the share in red. 44%, nearly twice as many, didn't believe the ABC and the Rudd glory story. And the other smart people, 32%, said they didn't know and didn't care. Yeah, well, Malcolm Turnbull believed it, apparently, and Twitter. But let's bring in the Executive Director of the Menzies Research Centre, Nick Cater. Nick, let's start with this big issue in that survey, and that shows really that people aren't strongly opposed to lockdowns. I wonder if that'll change in Victoria tonight.
Yeah, but I think what we do see there is lockdown hesitancy, if I can call it that. People are saying, you know, they can see big costs involved. But interesting, as you say, it's jobs and wages, number one, mental health, number two, and small business, third. And everything else, including debt, a long way behind. I thought what was interesting on the other questions that you mentioned there was that when we actually said to people, look, $3 billion for the first 3 weeks of lockdown. You could have built the Northern Beaches Hospital for that, which has got 500 beds. It's got a big emergency ward, etc., and invest in health facilities that could help in the next pandemic. Then people started to waver and people were saying, well, OK, maybe we should spend a little less on lockdowns and a little more on health. But as you say, you know, a good third of people just were saying, let's lock down whatever the cost. So I think clearly the fear factor is there. People are fearful of that. But I think the premiers need to note that there is hesitancy there and people are definitely noticing the cost, particularly the personal cost.
But the thing here is that two factors go together, right? The fear factor, which the survey showed is grossly exaggerated in the community, leads to people accepting lockdowns. Now, we've seen some more reporting today. The sorts of very rational, calm, expert opinion we get on this program, like Professor Peter Collignon, like Professor Catherine Bennett. In other media, the ABC and other commercial media, apparently those voices, those expert voices, are seen less often, and they go for lower qualified, more alarmist commentators. No wonder the public are scared.
Well, that's right, Chris. I mean, what we're getting is this argument, oh, it's got to be lockdown or nothing. But wait a minute, there are other things you can do. There are lots of other measures before lockdown you can do that will each one of them reduce the risk bit by bit. And if the risk is at the right level, as I believe this is not the highest risk, although it's a very transmittable virus, it's not as fatal as the previous variety. Not so many people are likely to die going from the British model. Then you react accordingly. And so it is heartening, as you commented, to see the Victorian opposition say just as much as that. They're not saying do nothing. They're saying do something, do a number of things, do multiple things that are much less damaging to the economy and to individual lives, but can still protect the vulnerable, which, of course, as we know, is mainly the over 70s, from death.
Indeed. Thanks very much for joining us, Nick. I appreciate it.
Thank you, Chris.